Hey, it's Chris with Rowe Dental Laboratory, and I want to introduce to you a brand new book we've put together to help you get to your final restoration for full art. And it's the Ultimate Restorative Protocol Guide. Now, in this book, we have different patient scenarios because they all present kind of differently as they walk into your office. They could be at the implant level, it could be at multi-unit abutment level, or it could be fixed on a temporary prosthesis and you need to transition into your printed try or prototype and then into the final zirconia. So we have all those different workflows for you in here listed, whether it's digital or analog, depending on the patient's current condition as to how they walk into your office. Today, we're going to focus on a lab scanner protocol. So it's more of a digital workflow that we're doing for the offices that have a lot more digital equipment, and one of them being a lab scanner. This is one of the most accurate ways to get data to the lab, because what we do with your restorations or records, bring them in the lab, we pop them in a lab scanner and we digitize them, and then we start working on it. So you're saving that time to send something to the lab if you have a lab scanner. There's a bunch of different options out there, and we can actually help you out with that as well. But let's get back to the workflow. So in this particular case, again, you could notice here, it kind of shows an overview of the scenario, and then it tells you the workflow here. And this is a very simplistic workflow. So the patient walks in, they're wearing their prosthesis fixed on multi-unit abutments. What you're going to want to do first is, of course, take a full face, full smile photo of that patient, have them standing up, nice straight on photo, because we want to see their smile and what we're starting with. Next, you're going to remove that prosthesis, and you're going to stick some lab analogs into each of the implant sites in that prosthesis. And you pop that into your lab scanner, and you're going to get us a 360-degree scan of that prosthesis. Next, you're going to have your intraoral scanner, because I'm guessing if you have a lab scanner, you probably have an intraoral scanner. You're going to scan the edentulous arch, capturing the multi-unit abutment positions. Then you take that prosthesis that you just did that 360 scan with, remove the lab analogs, reseat the prosthesis, and then scan the opposing and scan the bite. Upload those records to us, and from there, we're going to be able to fabricate a printed try-in for you to seat. It's a prototype of the final. Seat, go through the records and making sure everything fits nice, good speech, bites are ideal, good lip support, and then the next step is going to be your final restoration. So this is going to be a very helpful tool for all the offices out there, again, to tell you all the different scenarios and the various workflow options to get to your final fixed restoration. If you have any questions, give us a call here in the lab. Check us out on our website. You can download this as an ebook, and we can send you a physical copy as well to keep on hand. Please follow us on our socials, and we look forward to working with you on your next full arch case. Thank you.